Okay, good morning. Thank you all so much for joining us. I have Mitch and Amanda here with us. I can't believe we're here and it's May. I know with y'all with little ones and school events, May is quite hectic. So I appreciate you finding time to join us this month. But we have some great hot topics that we are going to start off with. Mitch is going to visit with us about the non-compete. And we also are going to open it up again towards the end for about 10 to 15 minutes of questions. So feel free throughout the webinar to brainstorm your questions. You may have come with questions, and that is great as well, but we'll open that up at the end for question and answers with Mitch and Amanda. So thank you all so much for joining us. And Mitch, I'm going to hand things over to you this morning.
Perfect. Thanks, Elizabeth. So back in January, the Federal Trade Commission proposed a new rule to effectively ban employers from imposing non-compete agreements. I know we covered non-disclosures in the last couple months. So this is just kind of tied in with the current administration, really targeting agreements that can impact an employee's ability to transition between roles, things like that. But while they extended the commentary window into April, we're still awaiting that final determination on whether or not they're going to implement it and in what form they're going to implement it, if there's going to be any changes, things like that. But they do estimate that it's going to have a significant increase in wages for employees and help expand career opportunities and really help facilitate employees to transition between different roles to help improve their growth, as well as facilitate healthy competition and facilitate innovation between companies. So if passed, employees would have 180 days to comply, but effectively it would be banning any contractual term between an employer and a worker that prevents the worker from seeking or accepting employment with a person or operating a business after the conclusion of the worker's employment with the employer. So, I mean, you'll see agreements nowadays where it's, hey, you can't work in this industry for the next couple of years. Things like that can limit an employee's ability to move around, or potentially, let's say you hired somebody and then that company reaches out and says, hey, there's a non-compete in place, you can't move forward with that person. So that's kind of what we're trying to, or what they're trying to target with this proposal. As part of it, they have a functional test to determine whether or not a contractual term would be a non-compete clause. So the term non-compete clause has the effect of prohibiting the conclusion of the worker's employment. Not necessarily specifically an agreement that just says, hey, you can't work in this industry, or hey, you can't work for these types of employers. But it can also include things such as a non-disclosure agreement between an employer and a worker that is written so broadly that it effectively precludes the worker from working in the same field after the conclusion of the worker's employment with the employer. So if it's something where it's targeting industry information that the employee may have gathered ahead of time prior to working for your company, things like that, where basically the employee is unable to work in that industry because of that non-disclosure agreement, under their de facto test, it would still be classified as a non-compete. Another aspect of it was a contractual term between an employer and a worker that requires the worker to pay the employer or a third-party entity for training costs if the worker's employment terminates within a specific time period, where the required payment is not reasonably related to the costs the employer incurred for training the worker. So where this gets a little bit tricky is, and you'll see it a lot in different industries where, hey, as part of working in this industry or in this role, you need this certification. So the employer will pay it. And then as part of that agreement for the employer paying it, the employee would then have to work for the employer for a period of time, or they'd have to pay that back. Well, what you'll see sometimes are things where, hey, we'll pay for this advanced degree, but then you're locked in with us for the next couple of years. So this is really to try and curb that sort of situation where the employer pays for something on behalf of the employee and then traps that employee effectively. So not only is it targeting specific non-compete agreements, but it's also targeting things like non-disclosure agreements that are too broad, as well as limiting those training costs to really hone them in on being reasonably related to the cost of training that worker. So under the ruling, the following would become illegal: entering into or attempting to enter into a non-compete with a worker, maintaining a non-compete with a worker, or representing to a worker under certain circumstances that the worker is subject to a non-compete. There is an exception for situations where you're selling off an entire business, where you could potentially have a non-compete in place. Basically, that's just to prevent somebody from going, oh, okay, I'm going to sell you my business, and then I'm immediately going to start up a competition with the money that you just gave me. But as part of the proposed ruling, the employee must be personally notified in writing, either electronically or physically, within 45 days that the agreement has been rescinded. As part of that, it does need to specify, hey, you're no longer bound under a non-compete. And that would apply to both current and former employees with an active non-compete in place. So where this would get a little bit tricky, and they're anticipating some challenges on this as part of, or at least in the current state of the ruling, but it would shift the burden for things like intellectual property protection or client lists, things like that, more onto things like non-disclosures and non-solicitation agreements to protect the company info on those client lists. That said, if the rule does take effect, you'll want to be very mindful of making sure that that scope is narrow enough that it doesn't suddenly become overly broad and essentially become a de facto non-compete. So if it is implemented in its current form, it would remove the use of non-competes like I covered, which in some industries is a method of retention. However, there still are other options that can help you retain your top workers. I know we've covered them a lot in the past, but I figured it's helpful to just kind of reiterate and help reinforce those ideas. So taking the time to understand why your employees leave, granted, different industries have different turnover rates, but if you're dealing with employees that are frequently leaving, job jumping, things like that, it might be worth taking the time to conduct things like exit surveys or employee satisfaction surveys to gain a better understanding of why those employees stay and why they leave. At the end of the day, that feedback can help you identify ways to help retain your employees. Look for trends. So if you're seeing that, hey, a lot of my recent resignations have been due to salary issues, it might be worth doing a compensation analysis to make sure that your wages are still competitive for the industry. If you see multiple people identifying that, hey, I don't feel like there's an opportunity to grow within the company, you can start looking into things like mentoring programs or developmental processes so that you can help retain those employees that are driven and looking for growth. If your employees are stating that they're getting burned out, start looking at work-life balance so that you can implement processes and programs to help retain those employees as opposed to suddenly they're going to walk away. Another big one that I've seen a lot of or cause a lot of turnover is change. And I know we've kind of covered some change management strategies in the past, but people get scared when they're dealing with the unknown. So taking the time to communicate if there's a big change coming in your company, take that time to communicate, hey, this is what's happening. This is why. These are the changes that are coming. And having that open line of communication with your employees so that if they have questions or they have some feedback on, hey, this change is happening, but we're running into this roadblock, you can help jump in and address it or answer those questions and help reassure them, as opposed to them wallowing in the unknown, getting more and more disgruntled, and then they end up leaving. The other aspect, celebrate those victories and those milestones. At the end of the day, employees like being recognized. They like that feeling of being appreciated when they accomplish something. So take the time to, hey, so-and-so did great on this project, or hey, this person's been with us for 2 years. Awesome job. Congrats on your work anniversary. Things like that will go a long way towards making those employees feel appreciated. As far as the aspects of protecting your intellectual property, again, make sure that your non-disclosures, there have been some tweaks to those fairly recently that we've covered previously, but it might be worth just kind of going through, making sure that your current ones in place are solid, that they pass legal scrutiny, things like that. That way, in the event that this law does pass and you have to start rescinding those non-competes, you can make sure that your non-disclosures are still strong enough that they'll be able to protect your intellectual property that's part of your company. You'll be able to protect your trade secrets and things like that, so that, you know, let's say you can no longer have those non-competes in place, you can still have some measure of protection for your confidential information. So with that, I'm going to go ahead and pass it over to Amanda, who will be covering some of the impacts of the COVID-19 emergency being lifted.
Thank you, Mitch. Okay, guys, get ready because we're going to touch a lot on insurance and medical things, but we're going to go very quickly and at a high level. And not going very quickly because it's not important. It's just a lot of things will more directly impact your employees, but we think it's important that you know that your employees could be feeling this difference at home. So as you may have heard on the news, or as we've mentioned, the actual federal public health emergency for COVID is set to expire this Thursday on May the 11th. And the most common reaction we have received, or just about anybody normal has received, is, oh, I didn't realize that was still technically a public health emergency, which, you know, again, just speaks to the new norm that we have been in over the last 3 years. But yes, technically it was both still a world health emergency and United States public health emergency. And even though it feels like COVID is mostly past us, a lot of the things that we're going to touch on today are the things that we have gotten really used to and benefited from being able to do in a more remote work society that may be changing or coming to an end. And again, I'll try to touch back on each one about why this matters to you, but you'll kind of see a trend there developing pretty quickly. Again, World Health Emergency already ended, and the actual US Public Health Emergency, excuse me, that's a mouthful, ends on here the Thursday, the 11th. And again, largely symbolic, but there are some other things that are going to be affected. And then just generally, we all know there have been less COVID deaths over the last couple of years. This is what all led to the actual end of the technical emergency. But even if it's not something you have had to deal with firsthand, if you don't deal with medical waivers or in the medical sector or with insurance billing or work with companies that do, you may have seen it for your personal health services that before you had to go into the doctor and now you may only do telehealth, or maybe there was a prescription that you used to have to go into the doctor before. It was more of a controlled substance that now you have to go in and get a refill on it. And what we're going to see here on a couple of topics is it's not just that now you have to go in and get that prescription in person. You may not be able to renew the prescription, even if you've been going for years. I have a dermatologist here in Houston. I haven't been into the office in 3 years, not because I can't, but because it was easier. There's going to be a 30-day window here after the 11th where there are 30 days I can have one prescription to be able to get me over into the next month. And this would be for any medications. I'm just using this example. But after that, I have to go in and physically meet that doctor. And so what you could see is maybe even someone for the whole duration of their employment with you might have been able to take care of some doctor's visits or some prescription refills outside of work hours, or maybe very quickly on a break using their phone or running down the street and taking a break. You may see more employees that are needing time off to go into doctors that they have never had to go into before, to go pick up a physical prescription that they may not have had to do for years. And you may see that shifting, especially when it comes down to this next month. Things are going to operate as usual until June, but then once patients are notified, oh, I can't refill that prescription until you physically come into this office, I would keep this in the back of your mind just as something it may not affect your workforce significantly, but if you start to see an increase in the number of doctor's appointments that is significantly more than before, it feels like that even as you're going along, just keep in mind that that has started again, and it's just probably going to require an adjustment period. Not that you have to work around every doctor's appointment. You can still ask for preferences and understanding from your employee, if it's easier for them to miss the beginning of a shift versus, coming in, leaving at 10 and coming back. You can still talk to employees about those things, of course, but just know that this may come up and they may have less choice in the matter of when they could get into the doctor, especially here at the beginning of summer. So those are some things to think of there. Also, the coverage of some of the medications and even just health insurance in general might be changing for some, the copays or what they might owe. This shouldn't be significant. Some of this shouldn't really impact us until some of the national supplies deplete. So we're not looking until 2024 possibly there, but things to start thinking about we'll touch on it again at the end of the year as you're thinking about your renewals on your benefits for next year. But these are things you might want to think about. We've even had one company that we work a lot with forward us a form from their medical insurance company. And even though it's May, it's mid-year, they had to make some decisions as far as what sort of ongoing insurance coverage they were going to provide. So it was things like, is it going to be in-network care to get an antibiotic related to COVID or get a booster versus possibly being out of network unless they go to one of these supplies. So if you get something or you got a flyer or a questionnaire from the insurance company this week that you weren't sure if it was legit or where is this coming from, this is not our renewal period, it's something you probably do want to go in and look at. And they can oftentimes talk you through exactly what that means. Here's what that dollar amount exactly would mean to not only you as a company, but to your employees so that you can make an informed decision there. But you may not have to. Insurance companies can make those decisions broadly on their own, but some are allowing it to the individual employers to make those decisions. So just know that that could come, but if it doesn't, there's no reason to panic. They would let you know in between now and then. Another thing just kind of generally be aware of is over the last 3 years, because of the different response acts, things like Medicaid and children's health insurance, their eligibility requirements were lessened or different as far as going in and things like that. So you may hear more employees asking about a change of life event as far as maybe coverage ending. Maybe they no longer qualify because the eligibility limits were raised during COVID. So again, if you start to see this uptick in medical questions or insurance questions, you may not, but it's just something to think about, especially if you are the person handling these questions at your business. And that also could affect adults as well, that they may lose coverage that they had before. So again, they might have to go to a different doctor or a different healthcare center, and just might be an adjustment period to get that changed over. The next thing is paid time off. Now, don't have to panic, anybody. This has not been a thing here in Texas, since that ended early in the pandemic as far as what the government required back in 2020. But I did want to mention briefly, because if you do have employees operating in other states, especially a state that has just a lot more employee-friendly policies. So the example I'm going to use right now is for Colorado, and this is one that had stuck out in my mind. So Colorado has had some slightly different sick leave policies. And it's not that they were necessarily written for COVID, that even though the national payment and I can't think of the word, reimbursement is the word I couldn't come up with, reimbursements for employers ended, Colorado already had a regulation in effect that during any public health emergency, so whether it was COVID or something else, there were different sick leaves provided or that employers had to provide. So that could be coming to an end for employers. Again, we're keeping it very high level because it's Colorado and not Texas, but it's something that if you operate in other states, you might want to be mindful of and just do a quick search. to see if that has changed at all for you or for any others. And again, most of the time there's going to be Colorado specifically, there's an adjustment period, like if the end is this Thursday on the 11th, there's a date in June when this will actually go into effect. So just maybe look out for that if you operate in multiple states. Another big thing, and the trend here is of how it affects you, is things have been a lot more flexible for a lot of us. And although it's not 100% related just to COVID, one of the things we have gotten really used to is the approval to do I-9 verification remotely. Many of us used to have to coordinate because somebody had to physically inspect that List A or List B and C documents. And if people weren't reporting to the office, we were able to do that over video, or somebody at a different location was able to do that. That is going to also be ending. Now, this won't go into effect until this summer. This isn't anything immediate. All of the guidance on exactly what is going to happen in these situations and what you need to do is not out yet. So this is probably something we'll touch base on as it gets closer to the current I-9 form. Actually, if you look at a I-9 right now, it says it expired last 2022 in November 1st, 2022, but they didn't put out a new I-9 knowing that there was going to be a change in how we do things remotely too. So the overall process is going to change. And so we may see some of those exceptions staying in effect. We just don't know yet. But it could be that come August, you have several physical documents that you are going to need employees to come in and bring in. Because if they were always only inspected remotely and now you guys are in the office, you're supposed to review some of those documents. Again, there's lots of nuance here that we are covering at a very high level, so nothing to panic about. We can talk more about it at another time. And once they give us more information, but know that that temporary policy will be changing in some way, shape, or form. And if you've been doing all of that through one person or one location, and we might have to start thinking about different ways to get that accomplished out in the field or at remote employees. And again, same thing, there'll be this in-between period where if it ends at the end of July, we'll have until at least August, if not more, to get this adjusted. So we'll know more about this and bring this up as the summer goes on and see what steps you guys need to take for that. Another thing just to keep in mind is that also is all the interplay between ICE and other Homeland Security organizations. So we may see other changes there and other things factoring into that decision besides COVID. It was just, again, one of those things that was more widespread and we got used to during the last couple of years. Again, more just informational purposes for you and how your employees' lives might be changing. It may not be something you've thought of it much, but there are still some people that are getting vaccines or boosters. We're not commenting on any of that, but just know if that affects some of your employees, that again, it might be harder for them to get an appointment to do that. Right now, there's a federal stockpile, and so it would still be free for that to happen, but you may be asked at some point with that too, do you want this covered under your healthcare insurance? That could be something that goes up in price for your employees if that's something they're going to maintain doing, like a flu shot year after year. And they don't know exactly yet, but the estimates that I could find online is, something about like a vaccine could be anywhere between $110, $130 a dose. So we'll know more about that, obviously, as time goes on, but just keep that in mind. It's one more thing impacting your employees. Also with COVID testing and things like that, if people were still able to get those for free at home, and once that is exhausted, that supply is exhausted, they may have to buy more of that. If they go into the doctor's office, and this is just for you to be aware of too, let's say you're not feeling well, you go in for something else entirely, and they say, do you want us to run a COVID test? It might be covered differently under your insurance, whereas you were not charged for anything before. You may now be charged for that. So that's just something to be aware of so you don't get a surprise bill after the fact. And same thing with other treatment things, whether it be antibiotics or some of the COVID treatments. You might see an increase in prices for yourself and for your employees. Also, just what hospital visits could be done remotely versus, oh, I touched on remote versus that, but even emergency care services, I apologize, I tried to switch back to you guys on a different subject, but the types of services that could be done at emergency care or at temporary clinics versus having to go in is also changing for some of them. Some of the approvals on what nurses or nurse practitioners could do, as opposed to having a doctor right there in the room. So again, all of this going into, it might be harder to get appointments. It might take a little longer. Your employee, let's say you're going through an FMLA with an employee and you're trying to get that paperwork done, or you guys are going through the ADA process and you've asked them to get paperwork completed by their doctor. There just might be a little bit of a hiccup here that we weren't seeing before. And if you see that happen, I want you to know that there is probably a reason behind it. It's not necessarily somebody being squirrely behind the scenes or not doing what you've asked them to do. And again, we expect that this will level out, but you might be affected by it over the summer. Other thing to keep in mind is just the telehealth services. I've mentioned this briefly, but the thing to keep in mind with it, or to try to understand, is it's not just your doctor's willingness to do telehealth. A lot of doctors enjoyed that for the things that they could, but they could also see more patients in a day that way. They might have been able to diagnose things over telehealth and they couldn't before. And some of them may be able to continue to do those things, but you might see some of these other services. The example that I use, I've talked to you guys a little bit before, just as other things have come up. I worked in a clinic for a nonprofit clinic where had speech services, occupational services, physical therapists. So services, so I know a little bit more about that, and it was one of the examples mentioned when I was researching, so I was going to use it. They have been able to provide those services to people, so speech services and connecting over Zoom, just like we are now. Some of those things are going to be not able to be reimbursed anymore. So right now they could do those services and still charge the insurance company just as they did for an in-person visit. And they may not be able to do that anymore. And so that may be out of their control as far as what services can be offered, what things your employees or their families can get over the internet. So again, this is all more complicated and we've already covered quite a bit with it today, but most of these things we're going to have, a flex period. So whether it's the change in Medicare services, your in-service services, or any of the other things that we mentioned, it's just because I want you to start thinking about these things, not that you'll necessarily have this run on your office on Friday because it's the first day after the health emergency changed. Even what things could be prescribed. The most common example that was used in my research was things like ADHD medications that could be during the pandemic online. Now they'll have to go into the doctor, things like that. And again, you might see the DEA step in and modify those regulations. You might see insurance reimbursements modify their practices in the future because things have gone well over the last 3 years, but it may not be immediate. So we might see some changes there. And then the last just kind of couple of minor random things that tie into this is, there are an estimated 6 million plus employees that are still working with long COVID. And so that effect might be major to their day-to-day life, and it might have been more minor. And maybe they just get sick a little bit more often, and you're aware of that because you've had an open dialogue with them over the last couple of years. Just because the health emergency ended doesn't necessarily mean they're going to be back to 100%. So you might still have to talk with them about ongoing infections and how that could affect them. Because if it is something that is anticipated not to ever be cured, it may still be an ADA condition, and that's going to be case to case. So if that comes up, give us a call. We'll talk you through that. If you have been watching the news lately, another one of the things that will be ending is for years, on the basis of it being a public health emergency, certain types of asylum and migration claims, the United States has been able to just flat deny people. And that is coming to an end. So if you have seen things about Title 42, especially with us being a border state in the news in the last week or so, and we could see some changes there as well. And again, that'll be an evolving situation as how it will impact us as businesses here in the state. Another minor thing to keep in mind, I was actually talking with an individual this weekend, and I don't even know how we got on the topic, but they mentioned they were fully disabled, and somebody I know, so they had disclosed that they're not able to work. They get a certain stipend on food assistance, and that amount has lowered because of the end of the public health emergency. And the difference was $100 a month. And you or I or many people we know may be fortunate enough to not notice or not to be a significant impact to our life if we were getting $100 a month less to spend on groceries, but that could be affecting your employees. And maybe it's not the person working in your office, but it might be one of their family members or somebody they support. So they just might have some more bills at home. And if you didn't already have people asking for raises or asking for higher wages due to inflation and other things, this is something that might be impacting them at home. Their benefits, outside of this, or their family members' benefits. And the last couple of things, even just the requirements for long-term care, if you had a family member in a hospital before they could actually move into a skilled nursing facility, the amount of time you had to spend in the hospital used to be 3 consecutive days during the pandemic. That was waived. And so someone might have been able to go into a skilled nursing facility sooner, whereas now that might be longer. So if someone is out, your employees are out because they're helping a parent, a loved one while they're in emergency care, but they're looking for a nursing facility, just know that might take a few more days longer. And it's nothing your employees are doing. It's just because the requirements have changed for the hospital and for the nursing centers. And also just the general reimbursements for emergency medical services. This is something that I don't know that we'll see a ton of direct impact at a significant level this year, but it's something we'll want to touch base on, especially closer to the end of the year when many of you guys are doing benefit renewals, because it's something that might affect your coverage amounts or that you might want to look into if you have seen that has created a problem for your employees. So thank you for hanging with me on that one. I know it was a lot of medicine and a lot of benefit information. If you have questions on any of those, or if we see other changes like with the I-9 coming through soon, of course, we'll be touching base with you guys on that. But I'm going to pass it back to Mitch here.
Thanks, Amanda. So for this next one, well, the previous 2 topics are kind of looking more forward with upcoming changes. Back in March, the EEOC actually released their annual performance report for 2022. And it was interesting data, so we figured we'd cover it. So in the last year, they handled over 73,000 new discrimination claims. So it was about a 20% increase over 2021. That constituted about an 18% increase in calls, 32% increase in email responses. And it really brought their level of charges back up to where they were pre-pandemic. So back in 2018 and 2019, they were between 72,000 and 76,000. So as part of that, in the last year, they ended up securing more than $513 million for victims of different forms of discrimination. During that, they increased their budget by about $26 million. Most of that went towards funding additional frontline positions, so things like investigators, mediators, field attorneys. So it was an increase in headcount by around 345, along with backfilling close to 500 positions. They also implemented a stronger outreach program, so they were targeting specific industries that were prone to vulnerable workers that would either have a higher likelihood of experiencing things like harassment and discrimination, or we're just more likely to experience it and not feel comfortable coming forward due to fear of retaliation. They also prioritized outreach towards small businesses. So based on that, I mean, they were really trying to focus their attention on areas where they could make an impact. In addition to that, I mean, more and more people are coming back to the office. As people start coming back to the office, people are going to have more interactions. More interactions means more opportunities for people to do the wrong things. So when you're looking at the data, 63.7 of the potential suit or the suits that they dealt with had to deal with the discharge of employees, with 42.8 alleging some sort of harassment took place. Of the violations, violations of Title VII were most common. So things having to do with them being discriminated against based on being some sort of a protected class. With 68.1 of suits included Title VII violations. ADA accounted for 29.7. Keep in mind, many suits allege more than one violation. So you could potentially see a claim of discrimination based on sex, race, as well as their disability or age or what have you. So the data was kind of interesting that 63.7% had to do with the employee departed. So what can you do? Well, with that focus on discharges and that being where most of those claims happen, we wanted to kind of dive into it a little bit further. Long before the EEOC charge takes place, it's worth taking a look at your policies and procedures to make sure you aren't creating any potential liabilities. And this starts early on. I mean, if you have discriminatory hiring practices, so say you're prioritizing only hiring younger workers, or you decide to hire only US citizens and you're not in specific industries that would require that, so things like ITAR and things like that, those will open the door to a lot of liability where, okay, your hiring processes are discriminatory. Somebody applies, they don't get selected, they can easily come back and file a claim, especially if your documentation isn't there to support it. Another big one that we see are not having a clear code of conduct. So if you have an environment where locker room talk or other off-color jokes are permitted, or you let it happen, all it takes is that one person getting offended and suddenly you've got a bigger issue there. I know HR has always been called the fun police, but there's a reason for it. I mean, inappropriate humor, one of the biggest things that I always covered in any sort of harassment or discrimination training I conducted was it doesn't matter your intention. You may be cracking jokes that are a little bit off color. You don't mean anything offensive by it, but it's not your intention. It's how it's perceived. So creating an environment where behavior like that's not tolerated at all reduces the likelihood of any sort of harassment or discrimination occurring considerably. Things like dress codes can be discriminatory as well. If you have dress codes that prohibit things like dreadlocks, beards, headscarves, those can unfairly target certain racial or religious groups. Gendered dress codes are actually becoming more of an issue nowadays. If you're not allowing an individual to dress in line with their gender identity. It's also worth taking a look at your policies to make sure you're complying with regulations such as FMLA and ADA. If you don't have a solid ADA process and policy, you may end up inadvertently discriminating against somebody based on disability. I actually had an email come through earlier today where there's a pretty big settlement where an employee had injured themselves and they were going to be needing accommodation for about 6 to 8 weeks due to a botched surgery. Well, the company just decided, we're going to fire this person instead of trying to accommodate him. Needless to say, they ended up paying out a big chunk of change. So making sure you have those processes in place to address a situation where an employee is experiencing a disability or they need to take some sort of protective leave will go a long way towards protecting yourself and the company. From there, take the time to train your team. Harassment training is a good base point, but one thing that I see happen fairly common is you have the initial training where everybody comes in, you sit in a room, you watch that DVD from the early 90s where it's got a bunch of cheesy actors spelling out harassment. Well, then it stops there. There's no sort of refresher training. There's no sort of reinforcement to go with, hey, we want to set this standard, we're going to reinforce it. So it's always a good idea to not only have that initial training, which is good base point, but have that refresher training in there. It's also worth training your managers and supervisors on spotting situations that could be potentially harassing or discriminatory. I had one where a supervisor we were investigating him because a client came forward and made a complaint about, or that one of our employees had made a discriminatory remark towards him. Well, another employee had reported the accused and said, hey, he was acting unprofessional. Well, the supervisor didn't dig into it. He just said, okay, well, I'll talk to him about professionalism, but didn't ask, okay, well, what was he doing that was unprofessional? So instead of it being something where we had an employee who made an unprofessional remark that was discriminatory that we could have addressed, now it's not just the employee that was doing that we had to deal with. We also had to deal with a supervisor that failed to act on it. So it's a good idea to be able to recognize those things. Yeah, you'll get complaints where it's, hey, I was harassed, hey, I was discriminated against, but oftentimes it's more, hey, I'm being bullied, hey, this person's making these remarks that make me feel uncomfortable. So being able to recognize those signs and training your team to recognize those signs is going to be huge. With the vast majority of cases involving termination, though, it's always a good idea to make sure that your documentation is in order. At the end of the day, we've all been there, you have that employee, you just want them to go, but taking that extra time to make sure that you've gone through your progressive disciplinary process and made sure that that final incident is strongly substantiated and documented, and that everything is strong and supports that termination will be huge if you ever have to defend it. I mean, I know it's tempting when you're dealing with that employee that just grinds your gears and you want to get rid of them, but if you decide to terminate them on a first offense, and meanwhile you've got somebody over here that they've been given 4 warnings and is still with the company, it's going to be a pretty easy case to go, okay, well, they did this because of X, Y, and Z, and you're not going to have the data to defend that. If it's performance-based, make sure that you have that strong PIP that has the data-driven results so that you can remove some of that subjectivity. If you can point to, hey, they were separated because this is our benchmark that all these employees can meet, they're only meeting 3 of the metrics instead of all 10, that's going to be easier to defend than, oh, okay, well, we just wanted them gone, so we hit them with an at will and called it good. The other aspect of that is if you receive a complaint from an employee, take action on it quickly. Make sure you do a thorough investigation. Even if that employee is on the way out the door, take the time to look into that complaint, see if there's any basis behind it. One of the things that I would always try to do if I had a harassment allegation, even if it wasn't substantiated, whoever's involved, they go through some sort of a refresher training, whether that's, hey, here's a copy of the policy, we're going to talk through it. Even though we couldn't substantiate it, we're still going to reiterate, hey, this is our expectation moving forward. That's going to serve 2 things. One, it shows that you take it seriously and that you're going to take those measures to address it. And B, let's say that there's another complaint that comes in. Well, now you have it on notice that the employee is expected to act this way. You can use that to help support whatever determination you make as far as disciplinary or corrective action. Another one that's always tricky is if you get a complaint from an employee, be mindful of the timing. If an employee makes a complaint and then you terminate them the next day, even if everything's squared away, it's going to look like retaliation. So you always want to tread carefully in those situations to make sure that, hey, whatever documentation you have can support that termination. Make sure that you address that complaint so it's not just you're getting rid of them to make the complaint go away. It might also be worth just checking in with your legal team if you have one to make sure that, hey, I'm not opening up any additional risk on it. That said, if you do receive notice of an EEOC charge, you're going to want to read through that notice carefully. It should spell out all the allegations, but make sure you follow those deadlines specified. If you don't get your response in time, it's going to look bad on you. Ideally, if you've done everything I mentioned before, you'll have all your documentation mostly squared away. I mean, there's always going to be little gaps here and there, but you're going to want to go through and organize that and prepare your defense. You have that initial response where it's, hey, you have one shot to make this go away. After that point, whether it goes through mediation, whether it goes through a suit, you're going to end up paying for it in some way, whether that's through the settlement, through trying to defend it through the legal system, things like that. So you want to make sure that initial response is strong. It may take multiple pages. I think our last one that we helped out on was like 80 pages, give or take. So when you're drafting that, make sure you have your previous disciplinary actions, any policy acknowledgements, copies of those policies. If those policies have changed over time, copies of the old policies. Demographic data can be helpful to show, hey, we didn't terminate this person based on any protected class. We've terminated everybody for doing this. So you can show that past precedence. So having all that data together, having a clear, coherent story is key, but be mindful of how you word it. If you're putting things in there like, hey, this employee was worthless and lazy, that's not going to help. If you have things in there like, hey, they were afforded multiple opportunities to correct their behavior, we have 6 formal counseling meetings, 2 formal warnings, and then we put them on a 3-month performance plan with weekly meetings with their manager to discuss those concerns, yet they still were unable to meet the standards set for their employees, that's going to look a lot better. Plus, that can help you show, hey, they had all these meetings, yet at no point did they mention any concerns of discrimination. And they even admitted that their performance deficiencies stemmed from a lack of personal motivation. So if you can pinpoint those aspects, that's going to help you a lot more than just saying, oh, this employee was trash, we didn't want him. So with that in mind, it might be worth bringing in a legal consult if you do get that EEOC charge. Again, you want to try and put yourself in that best position. So doing the extra legwork up front can save you considerably down the road. And I know I just covered that at a high level. I mean, I'm sure we could have spent the entire hour just talking about the EEOC side, but we wanted to kind of cover some of that data since I'm anticipating that with those budget increases, there's been some administrative changes to really emphasize that focus on trying to weed out discrimination and harassment. So I'm anticipating that there's probably going to be another increase for 2023. So with that, we're going to go ahead and open it up to questions if anybody has any.
And just a friendly reminder, if you don't want to unmute yourself and ask your question, you can always submit your question via the chat box and I can ask that to Mitch and Amanda. I'm going to give you all some time to submit those questions, but a friendly reminder, we do have our active shooter training coming up on Tuesday, May 23rd at 10 a.m. So I do encourage you to sign up for that. You can do that on our website. And I encourage you also just to share that internally with your leadership team or staff. Eric Williams is going to be the one presenting on that. And I know just unfortunately with the world we're living in, that's just a hot topic that I think all organizations can benefit from right now. Also, if you haven't taken the time to go ahead and sign up with Ironwood and have access to Mitch and Amanda and their expertise, I highly encourage you to do that. So feel free to shoot me an email and I would be happy to get that paperwork over to you as a valued client. Any questions?
So while people are taking the time to maybe think of questions, write them down, I figured we could cover some of the more common questions that we get as well. So one of the big ones that we see a lot is, how do you deal with attendance issues when somebody's dealing with, say, a medical issue or there's other protected leave in play? Maybe it's related to protected domestic violence leave in certain states, things like that. Where it's always tricky is if you're not tracking the reason for things like absences, early departures, late arrivals. If you're not tracking that, it's going to be a lot harder, especially if you're aware that there's a medical issue. For example, let's say somebody has FMLA. Not all their absences are going to be FMLA potentially. So being able to, whether that's as simple as, hey, this is a early departure form, so you left at noon instead of 5 o'clock. Have them fill out a thing that says, hey, this is the reason I'm leaving. If they put down FMLA, perfect. If it's to go get their car out of the impound or they're having childcare issues, things like that, that wouldn't fall under FMLA, then you can factor that into your potential disciplinary. And that's kind of where personally I'm not a fan of point systems that are no fault, because then it's easy to just go, okay, they get a point, they get a point, they get a point. But if you're not drilling into the reason behind those points, can get you into some hot water if you're not tracking that as closely.
And I know sometimes questions don't hit you at the time they need to hit you when you have access. So if something does hit you later in the day, feel free to shoot me an email and I'd be happy to get that over to the team. Or if you do have an agreement already in place and already have that all ironed out and situated, feel free to reach out to Mitch and Amanda directly regarding any of those questions. But as always, I know everyone's time is precious and every minute of every day, is valuable. So I do appreciate you taking time to join us. And I do hope you'll be able to join us in June. I can't believe summer is upon us, but thank you everyone for your time. And thank you, Mitch and Amanda, for your time and preparation for today.
Thanks, guys.
Thanks for joining, everyone.
Thanks so much. Bye.